My name is Rolanda Foley. I'm a graduate student at the University of Memphis. This is the health assessment class, and we're doing an assessment. This assignment is the teach role play for structural clinical evaluation. So I have my nursing student, Eric Foley, and then I have my patient. Can you tell me your name?
Aaron Foley.
Can you tell me your date of birth?
July 13th, 2004.
And can you tell me today's date?
November 24th.
So he is oriented times 3, Eric. So for this assessment, we are going to do a focused exam. We're looking at his respiratory system, cardiac system, and his abdomen. And then we're going to touch on his skin and his neurological system. Okay. So since we did his level of consciousness and he's oriented times 3, we're going to go ahead and look at his skin. So his skin looks good, the color is good, no bruising, scars, or lesions. Let me look at your arms, Aaron. Good moisture, good skin turgor in his skin, no edema, texture's good. We're gonna look at his scalp. I don't feel any nodules, any bumps or lumps in his scalp. His hair is healthy, thick. Let me look at your hands. I'm gonna look at his capillary refill in both hands. Okay, so if you see his capillary refill is good. And it's also good in that hand as well. Okay, so from there, we're going to look at his neurological system, and we're gonna do, look at the cranial nerves specifically. Okay, so first, since I'm behind him, I'm gonna look in his ears, okay? So his ears look good and clear, not a lot of wax. Tympanic membrane is gray. I'll look at the other side. Same, ear looks good. Tympanic membrane is gray. And so we're also gonna do, we're gonna test his hearing. So I'm gonna do a whisper test. So Aaron, when I whisper something, I want you to repeat what I whisper, okay?
1, 2.
Okay.
3, 4.
Okay, so hearing is good. Also, Aaron, I need you to walk to the camera and walk back. Good. So his gait is good, walks fine, no problems walking. So now we're going to look at eyes. Okay. Perla is good in that eye. Perla is good in that eye. And then you want to look at his conjunctiva and his sclera, which is good in both eyes, okay? So then we're going to test his oculomotor, and that's to see his eye muscles, okay? And I'm going to walk in front of you here. Aaron, I want you to follow my finger. Good. Good for motor skills, good for accommodation. So we're also going to do his first olfactory, which is smell. Can you tell me what that smells like?
A candle.
Okay, great. And then we're going to test the sensation on his face. Aaron, I'm going to touch this to your face, and you tell me if you feel it. And is that soft or dull?
Soft.
Okay, I want you to close your eyes, and I'm going to do it again. Is that sharp or dull?
Sharp.
Okay, close your eyes. Great. So we looked at skin, we looked at neural. Now we're going to start with his respiratory system. Okay. So Aaron, I want you to turn around so that the camera is facing your back. Great. So Aaron, if you can see, we're doing his posterior respiratory system. Okay. So Aaron, I want you to take a really good deep breath for me. Okay. So we didn't notice any accessory muscles, no tripod positions, no nasal flaring, no retractions, tachypnea, or cyanosis. So that's a good sign. If I inspect his back, I don't see any bruising or feel any lumps, anything abnormal when I inspect his back. So now I looked at his chest expansion when he took his breath. It was good. Now I'm going to do tactile firmness. Aaron, when I touch your back, I want you to say 99.
99. 99. 99. 99.
Great. So now I'm gonna assess his lung sounds, okay? Aaron, every time the stethoscope touches your back, I want you to take a breath for me, okay? Okay. Great. So there were no adventitious breath sounds heard, okay? So then we're gonna do something called E phony. Every time I touch your back, I want you to say E.
E, 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 E.
Okay, that was good. Heard it fine. Now we're gonna do bronchoscopy. Aaron, every time I touch your back, I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
All right, great. So from there, do you have any questions about the posterior?
No.
Okay. I also want to make sure to know that when we're listening for lung sounds, we want to listen to the sides, his sides. Okay, take a deep breath. Great. And then take a deep breath. Great. Okay. So if you can turn around, we're going to do his interior chest now. Okay. So just like his posterior chest with his interior chest, we're gonna inspect it, look for any lesions, any bumps, any nodules. We don't see any on there. Okay, and we're gonna do tactile firmness again. So Aaron, when I touch your chest, I want you to say 99.
99, 99, 99, 99, 99, 99,
Great. So, can you say 99?
99.
Okay, so I palpated and I auscultated for his breath sounds. He didn't have any advantageous breath sounds in his anterior chest. So since we're at the interior chest, we're gonna move down to his cardiac system. Any questions so far?
No.
Okay, so with his interior chest, we're gonna listen for his aortic, pulmonic, Erb's point, mitral, and tricuspid heart sounds. Okay, so we'll start with the aortic, pulmonic, Erb's point, mitral, tricuspid. And notice you're gonna go 1, 2, 3, 4, 5. So his five heart sounds. So from there, his heart sounds good. We heard everything we need to hear. And then we're gonna do his PMI, and that's for 1 minute, okay? So we're not gonna do the full minute since this is a demonstration, but I just wanted you to know that's what we're listening for. So we've done the posterior, anterior, we've looked at skin, and we've done neurological. Now we're gonna test for his jugular vein distension, and he has to be at a 45-degree angle, so I'm gonna flip the camera. Okay, Aaron, if you wanna take a seat, lay down. Okay, great. Aaron, if you can lay your hands beside you. That is good. Okay. Okay. So now we're gonna look at jugular vein distension. And you don't see any heaves or any lips in his jugular vein distension. And while he's laying down, we're gonna listen to his heart sounds again, okay? So we'll listen to aortic, pulmonic, Erb's point, mitral, and tricuspid. Okay? So since he's laying down, we're gonna progress to the abdomen. Since this is a demonstration, we're not gonna lift his shirt, but we're gonna say he doesn't have any nodules, any heaves. He's breathing in and out okay.
I can hear you.
Oh, I'm sorry. I'm not gonna ask him to lift his shirt, but he doesn't have any nodules on his stomach. And when I inspected earlier, he didn't have any scarring, anything abnormal. So now we're gonna listen to his bowel sounds in all 4 quadrants, okay? So we're gonna do positive vowel sounds, normal and active. Okay, so from here, we're gonna listen to his arteries. So we'll listen to his aortic, his renal, his iliac, left is over here, and his femoral arteries. They all sound good. 2+ bounding. We're gonna palpate for any tenderness. I don't feel any. I palpate liver. And I can palpate the spleen, which is good. Okay, Aaron, I'm gonna have you set up, and I'm gonna do your costal tibial angle. Okay, if you can move a little bit to the side so Aaron can see. Okay, you're gonna put your hands right here on his back. Does it hurt?
No.
And then you're gonna palpate. Okay, so that is gonna be our assessment, our focus assessment. Do you have any questions?
Nope.
Okay, thank you.